All right. Hello, everyone. This is Environmental Emergencies, and it starts on page 2196, and I'll get the end page before I post this. So, the learning objectives discuss principles of care for environmental emergencies, of safe, effective, and evidence based care for patients exposed to environmental emergencies. But what are these environmental emergencies? So, heat related illness such as heat stroke. Well, frostbite isn't heat, is it? It's cold. And then hypothermia. So, we're going to talk about those. Non fatal drowning. We used to call it near drowning, but it's now called non fatal drowning. Decompression sickness and animal and human insect bites. So, the first one we're going to talk about is heat stroke. So, heat stroke is when it's a medical emergency, and this is why we talk about environmental emergencies, caused by failure of the heat regulating mechanisms of the body. And this is triggered when the patient is exposed to the environment where the temperature is 102.5 or the heat index is greater than 95 degrees. So here in Georgia in the summertime, it gets really hot and people are outside playing sports, out on, Lake Oliver here or whatever, going down the Chattahoochee, Flint River, etc. And if, they're exposed for a long period of times and they're coined with or combined with dehydration, then it's going to cause this heat stroke. So this causes an inability to maintain the cardiac output in the face of moderately high body temperatures and is associated with dehydration. So the big thing, we're talking about prevention later, is, stay hydrated. Those at risk, not accustomed to heat, so people from up north or whatever, the young and the old are always at risk, unable to care for themselves. So people who need to be fed and given water to drink, and certain medications, such as tranquilizers, anticholinergics, diuretics, and beta blockers. So think about that. Diuretics are already going to dehydrate, right? So healthy individuals doing sports or work activities. So I suffered heat stroke when I was 9 years old. We lived here in Columbus, Georgia, went to Panama City, and I played at the pool all day long in the sun, had a blast. I met a new little friend, and we played and played and played and played and played. And then my dad, being, a nurse anesthetist, knew what it was, and he treated me, and I vaguely remember anything. So we'll talk about the signs and symptoms shortly. And my dad said I could have died. So it is emergency. It is a very serious heat induced illness. Heat stroke usually occurs during extended heat waves, especially when they are accompanied by high humidity. External heat stroke is caused by strenuous physical activity that occurs in a hot environment, like I was when I was 9 years old, just playing in the pool with a friend at the beach. So the gerontological considerations. So their circulatory system is unable to compensate for stress imposed by heat, decreased ability to perspire, vasodilate, or vasoconstrict. So their body can't compensate by vasoconstricting or vasodilating. They have less fat tissue. Now they might have fat tissue in their abdomen, but less subcutaneous fat in their extremities, etc. And they have a decreased thirst mechanism so that they may not know they have to drink fluids. And this happened to my 95-year-old dad, where he passed out. He didn't get heat stroke, but he just got dehydrated and he passed out and hit his head, but he was okay. Less ability to concentrate urine to compensate for the heat. So they'll pee more and they just let their fluids out. And they don't drink a lot of fluids because they're afraid of incontinence as well. And they don't go out. They might stay in their unair conditioned house because they're afraid of crime and things like that. So preventing the heat-induced illness. So a lot of things, of course, avoid high temperatures, and hypersensitivity to high temperatures may remain, for a considerable time. And I'm very sensitive to the heat. And yeah, I lived in Florida. I know. Maintain the adequate fluid intake, wear loose clothing, and reduce activity in hot weather. I tell you, my closet is full of Florida clothes. I had to go out and buy all new clothes for this winter climate. Monitor fluid losses and weight loss during workout activities or exercise, and replace fluids and electrolytes. So drink, Diet Gatorades, those smart waters with the minerals in them, etc. Use a gradual approach to physical conditioning, allowing sufficient time to return to baseline temperature. Plan outdoor activities, avoiding the hottest part of the day from 10 to 2. So when we lived in Florida, we either went to the beach in the morning and left by 11, or we went to the beach usually after 5 p.m. This is in the summer months, and we just watched the sunset. In summer, the sun sets at like 9:30. So we just did not go to the beach in the heat of the day. For older patients living in urban settings with high environmental temperatures, the nurse directs those patients to go to places where there's air conditioning, like the shopping mall, a library, or a church. Because if they just sit in their home, a fan will not keep them cool, you know. Now, here's some signs and symptoms. Who's at risk? The seniors, children, athletes, and outdoor workers. So we got to remember those folks, especially in the summertime. The patient will not sweat, or they get to the point where they can't compensate anymore. So 104 degrees outside. Well, also we said 95 and being active. Dry, hot, red skin. So they're not going to be wet and they're not going to be sweaty. Dizziness and a headache because they don't have that cardiac output. Pinpoint pupils and vomiting, and then they become unconscious. And again, the prevention is drink enough, no alcohol or caffeine. I was one time at a beachside restaurant, and this mother was trying to her daughter was like sitting on they were like picnic tables, leaning forward, and she couldn't arouse her. And nobody, and she was like, help, help. And she was Spanish speaking, and no one was helping her. So, and then this was a crowded, like outdoor restaurant. And I ran over there and immediately just grabbed her. It's amazing what strength you have, and laid her on the ground. And I told somebody to call 911 because she was, it's summertime in Florida and she was not sweating. And I immediately smelled alcohol on her breath. And I thought, oh Lord, she's been drinking alcohol all day, not rehydrating. And she was probably a 25-year-old young lady and her mom, with her family. And the minute I laid her down, she had cardiac output. She woke up and she was so embarrassed. And she tried to sit up again and she passed out again. Because the minute she sat up, no cardiac output. And I said, stay laying down. And the paramedics, they had a fire house right there on the beach, of course, because drownings and heat stroke. And there they were. And they showed up and I said, this is heat stroke, backed off, and they took over. Prevent, you can take cool showers, wear like protection, don't stay in a closed car. We're always talking about our animals and of course small children. Grandparents forget that the grandbaby's in the car, and that happens a lot, unfortunately. Limit outdoor time, like we talked about earlier. So assessment, diagnostic findings, and management of heat stroke. So the thermal injury happens at the cellular level. So the patient can have coagulopathies and organ damage. This is why this is so dangerous. So central nervous system dysfunction, they can have delirium, confusion, headaches, bizarre behavior, coma, and seizures. So an elevated body temperature of 105 or higher, hot, dry skin, and what we call anhidrosis, which is no sweating. And elevated body temperature and tachypnea, hypotension, and tachycardia. And that's the compensation because we've got dehydration here. The goal is to reduce the body temperature. And first, we're going to do our circulation, airway, breathing, and start IV fluids. And give either lactated ringers or normal saline. That's our isotonic, and we use that for fluid resuscitation. The core temperature is reduced to 102 within an hour. And what we do is we have cool sheets, towels, ice to the body, usually place it on the groin, the axilla, the groin, the armpits, things like that. They immerse them in a cold water bath. Don't dump them in ice. They don't do that anymore. Electric fan to augment the heat dissipation. And also they use thermometers such as in the rectum, the bladder, or the esophagus. If the patient has a Foley, there might be a thermometer in there. Or if they're NG tube or whatever, they'll have that in the esophagus. Monitor their EKG because they can have an MI or arrhythmias because of the fluid changes and the loss of, electrolytes. And seizures can also happen in hyperthermia and increase metabolic needs and urine output because we're watching for that acute tubular necrosis. So there's external and non-external causes of thermal injury at the cellular level, resulting in the coagulopathies and widespread damage to the heart, liver, and kidneys. So they start clotting and they can have DIC. When assessing a patient, the nurse notes the following symptoms. So they're going to have the CNS. We talked about that. Management is the mortality in heat stroke or morbidity progression in heat stroke with less serious forms of heat-induced illness is directly related to the duration of the hyperthermia. So how long have they been hyperthermic? Caution used to avoid hypothermia, because as we treat them, we can cause hypothermia and prevent hyperthermia 3 to 4 hours later, because their temperature can go back up. So the cooling process should stop at around 100.4 degrees to avoid iatrogenic hypothermia. So I'm going to pause it.